Good morning, everyone. It's Jen, nurse practitioner at To Your Health and Wellness. It is a cool Florida winter morning, so I thought I'd just be outside while I'm chatting with you guys today. Many patients are calling us. They're very curious about BioTe hormone postings I've been posting lately, and the main question they ask is, what are they and why pellets? So I thought I'd come on and just clear up a couple of things. Simply, what BioTe pellets are they're small little pellets, that's what they are, that are compounded drugs, usually testosterone or estrogen, that are used as a method of hormone replacement or HRT. You'll hear hormone replacement therapy or refer to it as HRT. Testosterone is one of the hormones that we aim to optimize when we do pellet therapy. Testosterone is important in men and women. People are surprised about that. As we age, we lose testosterone, and it is often overlooked as a very important hormone for overall health and well-being as we age. Testosterone, like I said, is very important for men and women. It has been proven over and over and over again to show that when we optimize our hormones, testosterone in particular, it promotes weight loss, lean muscle mass. We can improve sleep and stabilize energy levels and moods. And also it'll eliminate that brain fog that we have as we age. Testosterone optimization also helps with low libido. It also helps with erectile dysfunction, all of which are common complaints as we age and are associated with decreased quality of life. Remember, our whole goal is to make you feel better. In postmenopausal women, we can also use some estrogen pellets. Like I said, we can optimize that, but it's in a bioidentical form without the risk and associated side effects of synthetic estrogens. But did you know that women can have symptoms and report a decreased quality of life up to 10 years before actual menopause? This is why it's very important to talk to a certified provider to see if you're a candidate for pellets. It doesn't matter how old you are. Starting in our 30s, we lose hormones. At To Your Health and Wellness, Aaron and I both have been specially trained, and we've taken extensive continuing education about hormone replacement therapy, in particular pellets. So another question that we get, mostly from men who are already using hormone replacement therapy, is why pellets? What's wrong with the other forms? How does it compare to injectables or gels or creams? Well, pellets are new to most patients. However, they've been used in the United States clinically since 1940s. Now, just like every drug, there are pros and cons to every dosage form, and pellets, though, are often a very smart choice for patients, we believe, who have low hormone levels. We find that they're superior to other forms and modalities, mainly because the duration of their action and their release kinetics. A typical patient would have to apply a hormone cream or gel twice a day and apply the patches over and over again because they rarely stay on, especially if they have an active lifestyle, which we try to get you to. Or if they're injecting, they have to inject themselves 1 to 2 weeks every week with a slow release synthetic hormone like testosterone cypionate. While it's obvious the injections last longer than the creams, the injectable hormones, though, also come with the burden of injection. You have to inject yourself or travel to a doctor's office to be injected every week or two to have the injection done, like I said, not to mention the pain of injections itself. Sometimes you have to take 52 injections a year. Now, creams and gels provide a pretty stable hormone level. It can take a lot of time, though, for it to build up in your system for the effects to be noticed by the patient. Now, the cream and gel itself has to be carefully applied. It can't rub off to others, especially children, and it can be dangerous to even share a sink or a countertop where the gel is being handled when there's children around. Injectable hormones produce a very sharp peak and trough. The drug goes in at a very high concentration because of the absorption, and sometimes that can be a very dangerous concentration. You have to be monitored during the initial period very closely. And then you'll have troughs when it's wearing off, which can lead you to feel very crummy in the days leading up to your next shot. There's a reason why people are beating down the doors to have a shot every week. Pellets are inserted in our office subcutaneously. We numb the area. We're both trained providers, like I said. And the long duration of action, which is usually about 3 to 6 months of the pellet therapy, is preferred by most patients whose busy schedules can't afford to travel to a clinic every week for an injection. Or, again, they may be concerned about the creams transferring to their loved ones like we discussed earlier. So, at To Your Health and Wellness, Erin and I both are certified BioTe providers. We would be happy to talk to you more about bioidentical hormone replacements and how we can help you with your health and wellness goals. We have flexible scheduling, including some Saturday hours, evening hours, and even telehealth appointments. So call us today. Take the first step. If something doesn't feel right, let's see what it is. We'll be having you feel your best from the inside to out, hopefully. So have a great day, and we hope to see you soon.